His prostate volume is 78 cc and he's absolutely desperate for a solution.
Right.
Seems like a setup.
Amanda, why not iTunes? Sorry, no, why not Eurolift? Sorry.
Yeah, I mean, again, I don't think there's any problem with the age or comorbidities or increased PSA because the bone scan is negative or trust volume. The one thing which I'm very much worried is the mixed storage and voiding LUTS. These patients, irrespective of the other things, will perform slightly not as good as a pure voiding symptom patients. And he's otherwise quite good patient for local anesthesia, Eurolift, and I'm sure we can create a good cavity. There is a possibility he may have some residual storage symptoms, he may have to take some medications for a bit longer. I'm sure we can make his quality of life much better with Eurolift.
I mean, I worry about his high PVR, and I think the PVR is one of the things that seems to respond sort of the least. And if part of his historic symptoms due to his high PVR as well, then the procedure may not actually improve his symptoms enough to make it worth it. And again, we're putting a 93-year-old kind of unfit patient potentially through a procedure where they might feel stressed during the procedure, etc. And I'm not convinced that I'll be improving their quality of life or their symptoms that significantly.
So, any thoughts?
Yeah, I think if it's the only thing I had, I'd offer him an iTunes. I don't think it's totally contraindicated. So he could try an iTunes. Probably work very well. I don't know. It's an option. Probably talk to him about ISC as well. If he was up for ISC, it might be the option.
Christian, what about LATP?
So I first assess the patient. I think I'll do urodynamic studies to make sure he has blood obstruction. We have two trials, Pulverino and his team and De Stefantis that looking unfit patients. They were ASA3, some of them were anticoagulation, some were antiplatelets. The rate of complication was minimal, and yes, that can be a good treatment option. We have patients in our experience without a lung, sometimes can barely go on the table, so they are really unfit, and the results are predicted very quickly.
Would anyone consider offering a catheter for this man?
Yes.
Good electricity, independent stabilization. Should be the first option.
He doesn't want a catheter.
He doesn't want a catheter.
They said he was desperate for a solution.
Yes, so
C-section scenario.
we can talk him into the other solutions.
I think we've got 5 minutes. We've maybe got a chance for 2 or 3 killer questions to the panel.
To them, not to us.
If you could just go to the microphone so that people online can hear you.
Go all in. 5 minutes.
Thanks very much, very nice session. Just a quick question about hybrid procedures and if any of the panel tried them. For example, youngish patient trying to preserve sexual function with median lobe, resecting the lobe and doing Eurolift. Anybody has got experience with these and have them done, plenty of cases?
Yeah, I've done a few hybrid Eurolift type things, and sometimes it's a staged procedure, so people have had Eurolifts that haven't worked very well, and you look back in and it's sort of pinned up but not opened up, and then you do a quick laser BNI and it all opens up beautifully, but very difficult to counsel patients about what the likelihood is going to be because there's isn't evidence. So I've certainly been there, but they do quite well.
I had a very short series of Eurolift with BNI, I think 6 patients, and done under local again. I was quite skeptical how patient will behave when we use a laser for BNI under local, but patient performed very